in every job, healthcare assistants have their own jargon or their own medical terms that we use. There are certain things that we do not say as healthcare assistants, and these are some of the things that you need to avoid if you are having a healthcare assistant interview. These are some of the things that interviewers may not really look out for, but if you say them, they may put an interviewer off and may sabotage that chance of you landing that healthcare assistant job overseas. So let's go through some of these terms that you may need to avoid during a healthcare assistant interview. Now, what I'm trying to say is that even though you may have experience as a healthcare assistant in your country, and there are some terms that may seem normal and harmless to say in your country, there are certain terms that may not fly with HICWA or HIPAA overseas. So you need to try and avoid those when you are, when you're having an interview as a healthcare assistant with a potential employer. So let's go through some of those. Number one that I find is very common. People say it during interviews. People say it when they're actually working, if they never had the proper training. And this is the correct term to use when we describe incontinence wear. Incontinence wear are products that assist people who can no longer, hold their bowels, for example. And we try and avoid certain terms when we are describing incontinence wear. Number one, it's the word diaper. We do not say diapers as healthcare assistants or as nurses. We say incontinence wear. Babies wear diapers, not adults. Adults wear incontinence wear. Another common term that I find people use as well, you may get away with this one, but it's still frowned upon. And if you do say it, for example, when there's a site inspection with HICWA, they will flag you on that, and that is pads. To say, my patient uses a pad, my patient uses a diaper. So for example, an interviewer may say to you, run me through your morning routine. And you say, so in the morning, we take our residents for a shower, and then we change our diapers. And then we change our pads. And then we change, not ours, and then we change their pads. That is wrong. That is not the correct term. The correct term is incontinence wear. This is important that you remind yourself about this and avoid using the term pad or diaper during an HCA interview. Along the line of incontinence wear, another term that I find people use a lot is did you poop? Oh, did you do poo-poo? Or if an interviewer is asking you about your morning routine, your morning residence routine, and you're like, I change their diapers and I clean anyone who has poop. Nope, we do not say that. The term that we use to describe poop is bowel movements. So if you were talking to an interviewer, you would, instead of saying, I will change anyone who has a diaper with poop, for example, you would say, I would change any incontinence wear and remove and record, for example, any bowel movements. That would be the correct term to use, and that is a bowel movement. Please do not say poop. Do not try and say poo-poos or poopy or anything like that. Just use the correct professional term, which is bowel movements. There's actually different types of bowel movements, so an interviewer may ask you about those as well. You can Google those and you can familiarize yourself, because you will need to record that if you're going to be working as an HCA. Now let's go into number 3 of some of the things that people say that may lend them into the we are not hiring you as a candidate list. If you're going to be working as an HCA, for example, in a nursing home or in a mental hospital, you may be assisting residents who have Alzheimer's disease, which has now caused them dementia. And sometimes people who have dementia, not everybody, but certain people may have some behaviors. Their behavior may change and they may act in a certain way. What you are trying to avoid during an interview is saying, I'm not kidding, people have said this before, is, oh, I know how to deal with crazy patients, or I know how to deal with aggressive patients. The term aggressive was used often in the past, but we try not to use it anymore. So you do not say an angry patient or an aggressive patient. Instead, the term that we would use would be a patient who is exhibiting challenging behavior. So we do not use the term crazy at any point during the interview. These are some of the words that if you have been using, you need to wean yourself off them, as they may again land you with that email that says, sorry, you were not successful, and this is what we're trying to avoid. We're trying to get you in, not get you out and onto the list that says we're definitely not hiring this candidate. Now, you may be asked, why do you want to be a healthcare assistant by an interviewer? Now, when you're answering this question, you want to avoid saying things like there is no harm at some point in the interview asking how much is the salary. There is no harm in saying that, but you don't want that to be your answer. That would be your first question, or that would be the question that you want, very early in the interview, and the interviewer is like, do you have any questions? And the first question you say is like, how much are you guys paying? You want to try and avoid that. So avoid asking too much about money. Most interviewers will cover the salary stipend, or this is actually a catch for an interviewer to see that, did you read the application or the job advertisement in full? Because sometimes they will actually mention in the advertisement how much is being offered. So you don't really need to ask during the interview how much is being offered. So read the advertisement in full. You may not need to ask the salary that is on offer. But if you do have to ask it, if it was never advertised and you do want to know, because it's standard to find out how much a company is offering, ask about it in a professional manner. And I would suggest as well, ask about it after you've asked a few other questions that are related to the job as well. Something else that people say during an interview that they need to avoid is that some people think that saying things like, if an interviewer asks you that, oh, if you see your colleague doing something wrong or abusing a resident, what would you do? And some people would say, oh, I would address my colleague and say, stop it, please do not do that. And if they do it again, I am going to report it to management. That is wrong. Wrong. Any shape or any signs of abuse, you stop it immediately, and you report it immediately to management. Don't be shy about this. It's not like the interviewer is going to be like, oh, we don't work with snitches. It's not that kind of vibe. In healthcare, we do not tolerate abuse in any way, shape, or form. If we see any signs of abuse, or if we see abuse occurring in any way, we stop it immediately, we address it, we stop it immediately, and we report it as well, and make sure that it is documented. Something else that you want to avoid when they ask you the question, why do you want to be a healthcare assistant? Avoid saying things like, oh, I looked after my grandmother, and I think, old people are very cute. I think they're very sweet and they're very cute. Try and avoid saying things like that. Older people should not be treated as children. They are not children. They are adults, respected adults. So we do not use the term like, oh, they're so sweet and they're so cuddly. Avoid using the term like that. We want to give up a vibe that is professional. So we only address elderly people in a professional manner, and it is not appropriate to treat them as children, as that is not what they are. So those are some of the terms that I think people, or those are some of the things that I think people say, or that I've seen or heard people say during an interview that made me go like, those are some of the terms that you need to avoid. So that is it, guys. I made this a short video as I just wanted to cover some of those points. If you enjoyed this video, I would really appreciate it if you subscribed. Let me know in the comment section if there are any terms that you've heard in the past that you've said, I shouldn't have said that during an interview, and I can tell you if that was good or if that was bad. If you've missed out on a lot of interviews, you can actually leave a comment below. If you've attended a lot of interviews and you've been turned down and you think that there's something that you're doing wrong, comment below, and the first 5 people who comment, I will do a Zoom call with you and we can do a mock interview together, and I can tell you if this is wrong or this is right, and who knows, I can help you practice for that interview. And yeah, guys, thank you for subscribing. If you haven't, please do, and I will see you in the next one. Bye bye.